हाय फ्रेंड्स, वेलकम टू क्लासेस बाय लैब डॉक्टर। आज के क्लास में हम बाइल सॉल्ट्स इन द यूरिन के बारे में जानेंगे। Bile salts or bile acids for that matter are nothing but steroid acids. So these bile acids are produced by the liver, and these bile acids are conjugated or they are mixed with taurine and glycine, and that is what give rise to this bile salts. You know that these bile salts, whatever are there, they are very important part of the bile. Okay, and these are needed for various functions of the body, like वो फैट डाइजेशन के लिए हो, फैट ब्रेकडाउन के लिए हो, विटामिन एब्जॉर्प्शन के लिए हो, या तो एलिमिनेशन ऑफ द टॉक्सिन. So these are very important part in the bile, and this bile whatever is produced, which is produced in this liver, it is stored in the gallbladder when we are not using it. Whenever there is fat inside the stomach and the intestine, this bile is produced and it helps us to digest these. So if the gallbladder is removed, sometimes when you have a cholecystectomy, there might be some kind of a bile salt deficiency also. So this is the liver where we produce the bile. So in this bile will contain the bile salts, and these are stored in the gallbladder. So this is the common bile duct. Once the food enters the duodenum, the bile salts are sent into the intestine, and they help in the digestion of the fat or lipids, etc. And these bile salts are also reabsorbed from the intestine into the hepatic circulation. So what are the functions of the bile? I've told you they are very important for the digestion of lipids and fat. So it is having a digestive function. It also helps in the absorption of certain vitamins. For the absorption of the fats, it is very important. For the excretion of toxins, etc., we need it. It also has a laxative action, antiseptic action. So it also maintains the pH in the gastrointestinal tract. It prevents the formation of the gallstone, and it is having a lubrication function. So these are the functions of the bile. Bile salts along with bilirubin can be detected in a certain kind of jaundice, that is the obstructive jaundice. So I've told you, in an obstructive jaundice, whenever there is an obstruction, for that matter because of a gallstone, so the conjugated bilirubin, when it is raised, it will spill over into the blood. So you will get conjugated hyperbilirubinemia. This conjugated hyperbilirubin is also seen in the urine, and whenever there is conjugated bilirubin, there will be bile salts. So bile salts and conjugated bilirubin regurgitate into the blood from the biliary canaliculi, and they are excreted in the urine. So whenever you see conjugated bilirubin, there will be bile salts, and the test which we use to detect this bile salts in the urine is called as Hayes surface tension test. So what is and how do we do this test? We take some fresh urine in the glass tube. So then we sprinkle on the surface particles of this sulfur. If bile is present, then the sulfur particles will sink to the bottom, because this bile will reduce the surface tension, and then the sulfur particles will sink. Suppose if the bile salts are absent, then the sulfur will not sink down. So if the sulfur particles remain on the surface of the urine, bile salts are absent, and if it is sinking down, that means there is bile salts in that urine sample. Sometimes we use thymol as a preservative. This can also give you a false positive results. Okay, so this also has to be remembered. So I have told you that bile salts will reduce the surface tension, and hence it will help the sulfur to sink down. So that is how the sulfur will come down, because the main function of the bile salt is to reduce the surface tension. So I have told you that in case of post-hepatic jaundice, you will see that there is conjugated bilirubin. Whenever there is conjugated bilirubin, bile salts will be present. In pre-hepatic jaundice, there is no conjugated bilirubin. Hence, there will be no bile salts also. So always remember, if there is conjugated bilirubin in the urine, it also will be accompanied by bile salts. In case of obstructive jaundice, I have told you, because of the conjugated urine which is present there, the color of the urine will be dark colored. And because there is obstruction, no urobilinogen is formed, the stool color will be light colored or a clay colored stools, which you see in case of obstructive jaundice or a post-hepatic jaundice. But in case of pre-hepatic jaundice or in case of hemolytic anemia, etc., the urine color is normal. Unlike the post-hepatic jaundice, here it will be normal color, but the stool color will be dark brown, because in case of pre-hepatic jaundice there is increased urobilinogen. So because there is increased urobilinogen, it can get converted into stercobilinogen and the stool color will be dark brown. So this is how we differentiate with the help of conjugated bilirubin and bile salts the difference to differentiate between pre-hepatic as well as post-hepatic jaundice. Though in routine urine microscopy we do not do this test bile salts, but they also help us to identify or to differentiate between a obstructive jaundice as well as a hepatic jaundice. So that is all about bile salts in the urine. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.